Hey everybody, I am Dr. Kelly Weisner with Flourish Columbus, and we are here to talk about why we're over it. Specifically, why we're over the traditional insurance-based models. So we are talking to cash-based physical therapists all across the country of why we have decided to go with a cash-based model, how it's giving us as providers freedom to treat the way we want to be treated and the way our clients need to be treated, and how it gives freedom to you as clients and patients to get the care that you need. So we are so excited to bring this series to you and can't wait to give you lots of great info.
Oh, that's amazing. And I am Jen Morgan out of Centrality Wellness. And we are here today with someone who's just an amazing, badass cash-based PT from Boston. Her name is Alexandra DiGrado. I'm going to let her introduce herself because her bio is amazing, but we'll give a little background story and she can even touch base on how she transitioned into cash. So thank you, Alexandra. We're so excited to have you.
Oh, it's my pleasure. Thanks for inviting me. This is so fun. I love this topic. So do you want me to just start out saying kind of how I started the business or what? Yeah? Okay.
Yeah.
So I worked for a big hospital in Boston and loved it. I was working exclusively as a pelvic health physical therapist. And I just started getting a little bit burnt out with seeing so many patients every day and seeing just the volume and then trying to rush through the visits, kind of treating everybody in 30 to 45-minute increments. It was really difficult, especially patients who had experienced sexual trauma or abuse, to get a really good visit done in that amount of time. And so then I became a mom myself, and I realized just how much is left out of postpartum care. And so I said, why should I go back to the grind? I want to just be able to spend the time I need with patients. And so I decided to start Boston Pelvic PT.
Cool. Super cool. And just so people know right off the bat, Instagram handle, you are on Instagram, right? How can they follow you? How can they find you?
Boston Pelvic PT. That's it. Mm-hmm.
Awesome.
Made it easy. Made it easy for you.
Great. So when you started Boston Pelvic PT, did you know you wanted to do the cash-based model from the get-go? Kind of talk to us about how you made that decision. I know we kind of touched on that briefly, but what are the benefits you see being cash-based as a provider?
Sure. Okay. Well, yes, I considered taking insurance with pelvic floor or pelvic health physical therapy specifically. I think there's a lot of denials. And so, for example, dyspareunia, pain during sex, is not considered a reimbursable code. And I just felt like I wanted to not be restricted in who I could see and how long I could see them for. And also felt like I could better serve my clients and my patients if I wasn't kind of sticking with the traditional healthcare model through insurance. So I guess the benefits for me were that I could spend longer with my patients, which I think for pelvic floor specifically you really need, and then also be more available because I'm seeing less patients in a day, so I don't have that burnout factor. So I'm really available kind of in between visits, either making programs for people or answering little questions. And I felt like, that would be the way to go so I could have that quality of life.
Yeah. And what is your breakdown? How long do you see patients for? Like, what is your eval time compared to like your treat time?
Sure. So I really don't have a specific time frame. I usually see people for around an hour, but I always have a buffer between patients in case we need an hour and a half or if we need a little longer. So I never want people to feel rushed. I certainly don't want to feel rushed myself if we're onto something really good. But I would say typically the initial visit is between an hour and a half, and then the follow-ups are an hour.
Cool.
Yeah. Yeah, it's amazing when you can actually relax and just take time to get to know somebody and have them feel comfortable with you and vice versa. I feel like you get down to the root of the problem and actually can treat it more efficiently.
Absolutely. Yeah. So when you first started out, did you have any challenges as far as getting your community to buy into the cash-based model, or how did you go about educating people on the benefits and why it's such a great model?
Yeah, absolutely. So yes, I would say for sure. I think with people's deductibles these days, it's certainly actually more cost efficient sometimes, more often than not, to go this route. And so yes, there has been some challenges with buy-in. Since I have my own business, I can be a little bit more flexible. So for example, during this pandemic, a few current patients lost their jobs. So I was able to make the decision for myself to give some individuals discounts who really needed the therapy but couldn't afford it necessarily. And so that was one of the awesome things about being able to continue to treat people. But in terms of reimbursement, I do give a coded receipt for people. So if people are worried about the insurance aspect of it, I do have, the CPT codes and the all the information that insurance companies ask for in an invoice. I mean, people are calling it a super bill. So
Yeah.
that is comforting for people. I think, once they know, oh yeah, I can submit for reimbursement. And it seems like people have been having pretty good success with out of network benefits for that.
Great.
That's amazing. And so, how do people find you? Like, do people have referrals when they can find you? I don't know the rules in Boston, right? Because Boston's probably different than Indiana, where Kelly is, or where Connecticut, where I am. Do they need a referral to come see you? Like, what does that look like? I know every state's just
That's a great question. So Massachusetts is a direct access state. So you don't need a referral to come to see a physical therapist. I have not yet had a patient with a physician referral see me.
that's
So, so no one that I've seen so far. I started the business, I suppose technically in December of this past year. So it's pretty new still. Nobody has had a referral from a physician, although I do have some relationships with physicians. A lot of my referrals come from moms groups, in Boston, and I have a baby myself. So kind of word of mouth through different moms. I've done a couple in-person workshops with a local group called Boston Naps. They're incredible. They have all kinds of services for new moms. And then I also did a webinar with them. So that was definitely a great referral source.
super cool. So you're doing more of like a direct consumer marketing strategy, right? So you're not going to physicians. You're not like, let me bring some cookies and let me tell you about PT. You're really going and marketing to the people who need you.
Yep, absolutely. And so I would say typically, shockingly, shocking to me, but maybe not to y'all, I have gotten so many patients through Instagram. I mean, I try and post just really valuable stuff. Every time I post, I'm like, okay, will this help somebody figure something out that will help their lives be better? And it really resonates with people. So I'm really new to this whole thing. And so I've just been so pleasantly surprised by the positive feedback. And then people just direct message me and reach out. And then I either see them virtually or in person. And it's been awesome.
That is super encouraging because my business is getting ready to open its doors. So yeah,
Awesome.
just hearing your story is like, yay, it can happen. It
Oh
does
yeah,
happen.
it does happen. I mean, obviously right now is such a unique time. So I've been
Yeah.
seeing a lot of patients virtually, but sometimes like there's nothing like the hands-on. So I've been trying to like pivot, not panic, right? So I just spent the last couple weeks making a virtual postpartum healing course that I'm going to launch in a couple weeks. So that was really cool just to say, okay, what can I do virtually to help people? But yes, it is possible. And right before everything closed, because Boston closed completely. I don't know about where you all are. I was completely booked. So the week we closed, I didn't have a single opening, and I started in December, and that was in March. So that's December, January, February, March. So it took 4 months for my schedule to be fully booked.
Wow.
Okay. That's awesome though. That is so great.
That's
Yeah,
amazing.
now it's a different story, right?
Well,
It's like
yeah.
the world stopped in a lot of ways, but
Yeah.
I feel like I want to hashtag pivot, not panic. I think that that's really amazing. When you said that's amazing.
Oh, good.
So what about, I have a lot of people call me and they're like, oh, do you take my insurance? And I think a lot of that comes from the fact you call your doctor's office and the first thing they ask you is your date of birth or your insurance. They don't even want to know your name.
Yep.
In Connecticut, there's not many cash-based providers. Is that the same in Boston? Is that how it is around you?
Yeah, I would say for sure. I think some postpartum care, like lactation consultations and stuff, are reimbursable, but typically people will pay out of pocket up front and then get reimbursed. Although don't quote me on that in the sense that I'm not really sure, but it does seem like my clientele is a little bit more used to paying out of pocket for certain things and are surprisingly well versed in seeking reimbursement. Like a lot of times they know they're out of network benefits. Boston is just a really well-educated consumer. So typically people come into it and they've already looked on my website. They already know I'm out of network and they come with a plan.
Wow. That's actually amazing. That kind of, are you already have buy-in by the time that people have called you or are actually physically in person with you, which is pretty interesting.
Yeah, I would say I've probably lost about 4 clients total to the lack of insurance, and I can think of each of them. And it's definitely a risk that you take, but I don't regret it. And I've had a lot of physicians advise me to accept insurance, but I think the reimbursement rates are not great, and it also would sort of lock me into a model that I'm not looking to be in.
Yeah. Right. Yeah. Yeah. So another big question is Medicare. So being in the cash-based model, Medicare clientele brings up a different kind of piece of the puzzle. So do you have many people seek out your services that do have Medicare as their insurance, or kind of how do you go about
manage that? That's a great question. So far, my primary clientele has been much younger. So I haven't had anybody that has Medicare yet. I know you can see somebody as sort of wellness or coaching if they don't have a specific physical therapy diagnosis and need, but I haven't crossed that bridge yet in my own business. So that's certainly something I'll need to learn more about.
Yeah.
Totally. No, it's a gray area, which I think as PTs, we live in the gray, which for some is great, and I've learned to come around to the gray, but it's definitely something that you need to kind of research, and there's some really good resources out there. So if you are a Medicare patient or someone who is using Medicare and you were watching this, like there are so many good resources to seek out, to read about, and to also talk to your PTs about.
Yeah, and I think in terms of seeing people for wellness, there's so much that you can do with a quote unquote healthy individual, and not necessarily looking at it from like an illness perspective, and more so from sort of a wellness perspective. So
oh my God. Yes. We are living in sick care, right? We are and I think that for someone who has a history of working kind of like you, right, in systems and clinics, and we are so used to defensive documentation, explaining ourselves to people who have no clue what we do, and only treating the diagnosis. When someone comes in with like pelvic pain, but they're like, oh, but this also hurts. These things are connected. And
you're like, I can't touch that.
Sorry, I have to pretend like you don't have a shoulder.
I have to get a separate referral.
Yeah.
That was insane. That blew my mind when I graduated. I've been a PT now for 10 years, but initially that really blew my mind. Like neck pain and shoulder pain, 2 different referrals. It's really wrong.
So wrong. And I think you touched on a really good point with wellness, that like it really is about healthy care, right? Caring for the healthy individual, but we will be better. And there are a lot of people who are not body aware and who are not aware of what is normal or common but isn't optimal, right? So I know it just opens up a window for so many other people who can live a better and healthier life.
Yeah, absolutely. And setting you up for success later on, I think too, especially when we're looking at women heading into menopause and all the changes that take place. There's so much that you can do preemptively to help set yourself up for success and sort of a smooth transition or experience through menopause. I think there's really a lot to be said there.
Oh yeah. I love that. I love that point. Love it.
Kel, have you had a lot of people reach out to you that are on Medicare-based insurance in Indiana?
I would say yes and no. I think my business partner Aubrey and myself, we just from our previous experience of working in a general outpatient clinic, we have a lot of friends in the community, previous clientele that are Medicare clients. So we've had that question before and kind of just had those conversations of how do we navigate those waters and how can they still experience our services in, appropriate legal manner. So I would say, we have definitely had those questions from the community and something we want to educate about because we do have a good range of ages here in Columbus, Indiana. So yes and no.
Totally.
Yeah, I feel like I certainly need to learn more. I went to CSM a couple years ago, and they were talking about it, but the person who was presenting was kind of using like a more of a scare model, like if they have Medicare, don't go near them. And I was like, oh, okay. But so yeah, I do think there is a lot of unknown about it, and too bad because those people could be helped.
100%.
Yeah. I've run across some good resources just of people who are coming from the cash-based model saying, these are the rules, this is what you can and can't do, and so there are those resources out there, of people who are educated and well-versed in knowing that and giving you kind of a good guideline without being like, don't touch them because, we can definitely work with those clients and we should.
Yeah, that's great.
So what resources did you use to start off your cash-based practice, Alexandra? Like, where did you start? You're like, you know what, I'm over this, I'm done. But then you probably don't know. So then where did you start trying to build your knowledge before you launched?
Sure. Yeah. I talked to other pelvic floor physical therapists who are doing it. So I was living in New Orleans before my baby was born, and my friend Sarah Reardon has a practice, The Vagina Whisperer, NOLA Pelvic Health. And so I chatted with her quite a bit, and she kind of started me off on the right foot. And then I was also seeing clients. I had a few patients. The wait list was so long at the hospital where I was working. I had people come back around who were like, I just don't want to go through that. I'm not interested in that rigmarole. Would you consider seeing me privately? So it happened very organically for me. So I had probably 4 or 5 clients that I was just seeing at their homes, kind of more concierge style. And it was great because I already knew them and knew that they weren't sketchy, for lack of a better word.
Yeah.
And so it just was so refreshing to work with those people. And I loved being able to take my time and see them kind of on their schedule and my schedule and not be pinned down to, like, at the time I was doing like a 7 to 4:30 kind of thing. And then I had Tess, my baby, and I realized it would just be so much better for my lifestyle to be able to continue that. And so we moved here to Boston, where I'm from, and my family's all here to help me with the baby. And then I was like, let me just jump right in and I'll just start this business. And so I just got like a DBA, like a doing business as, in Boston. And I rent space from an existing physical therapy clinic. They have private treatment rooms in 2 different fitness centers. And so I use the space when they're not using it. And it was just super because I only pay for the space when I'm in it.
Ooh,
So
that's awesome.
yeah. So, like right now, obviously with this whole pandemic, I'm not, paying rent, which would have been a nightmare for a new business. So I just, pay a percentage of each patient when I'm in there. Yeah.
That
So
is
I guess
awesome.
I don't know if that's specific enough for how I started, but that was kind of how I
Yeah.
started, really.
Yeah, that's great. I love that.
Thanks. Yeah, I know. It kind of all I shouldn't say fell into place because it's obviously hard work, but I got somebody to make a logo for me and, kind of just learned as I went a little bit.
Yeah.
No,
And I think the beautiful thing about social media and the internet is there's so many people out there doing things like we are wanting to do and are doing. And I don't know if it's just like I don't know, special to PTs, but we all just seem like everybody wants to help each other.
Oh, so much so. I love that. Yeah.
It's so refreshing to, connect with people across the country of like, hey, this is what I did and this is how I started and you can do it too. And I mean, how awesome is that as a profession?
Yeah, I have a friend who always says, there's plenty of vaginas to go around.
Yeah.
I treat men too, so I mean, it's not even like totally applicable, but yeah, like there's that, not as much of that competitive spirit, not to interrupt you, Kelly, but I just wanted to say that.
That's great. I just think, it's in our nature as therapists to help not only our clients, but our fellow PTs, and how beneficial for everyone. Like, it's so cool.
Yeah, I agree.
Oh my God, I love that. I know, like Nicole Cozine always says, as the tides rise, all the ships in the harbor rise. Like I feel like pelvic PT in particular, I mean, I'm totally biased, but it is very inclusive. And it's really cool to hear that, like, you were not waiting for the right moment. Because I hear that a lot. Like, let me wait for the right moment to launch my business. I fall into this category, right? Like, I read all the books. I read Danny Matea, Fuck Insurance. I read Aaron LeBauer. I've done all these things.
I'd never even heard of those until you posted it on your Instagram last week. So I didn't read any of it.
Yeah. Oh my God, that's amazing. Danny Matea, as I'm reading right now, I'm like 85% of the way done with it. And the other day, he's doing it digitally, so it's amazing. And then Jared Carter is really good too with the Medicare stuff. I
need to start writing this down.
Oh, don't worry. We recorded this. You can just rewatch it.
Yeah, perfect. Awesome.
But yeah, no, it's imperfect action. I think that COVID, you kind of touched on it, right? Like, pivot, not panic. Like, imperfect action to give this awesome, beneficial material is now's the time.
Yeah. Yeah. Right. Mm-hmm. Yeah, there is no good time. There is no bad time. It's just
right. Now is the time. Yeah.
Yep. Mm-hmm. Yeah, just go for it. And obviously, that being said, my husband is so supportive. So it's not like I did it on my own. Like, obviously I have somebody else at home that's helping pay the rent while I get this thing going. But yes, I mean, I think it was pretty successful right out the gate. So, I would encourage anybody who's thinking about it to give it a try. It's definitely a hustle for sure. Just kind of like keeping your name out there and keeping people aware that you exist, and sort of increasing access and also awareness about pelvic health. But if we all love what we do, it's fun. I could talk about this stuff all day. So in that sense, it doesn't always feel like a hardship. It feels good.
Totally. And I think overcoming the barriers, it's part of the hustle. But I think once patients realize that, you pay a copay, say your copay is $40 and you go 3 times a week, that's $120, right? Where you can have this much time with a PT and then you're kind of off in the gym doing your own thing. Whereas for you're paying for 60 to 90 minutes of one-on-one specific to that person, whole body care, not limited by referral or insurance. They can get reimbursed potentially depending on their insurance. It's like, why not? Like, that is so much more ROI, right? You're getting so much more return on your investment in your health. It's crazy.
Yeah, absolutely. Plus just the specialty, I'm PRPC. And so in that sense, I feel like you are, in a sense, kind of paying for somebody who truly is a specialist in their field and passionate enough to go all the way in terms of education and now after 10 years experience too.
Totally.
Oh yeah.
So it's hard to toot your own horn though, like I definitely struggle there. As all PTs do, all physical therapists, I think we're not naturally that way.
No, we are not really good at like the marketing aspect about, there are some specialties or some other licensed professionals that are really good about the business and the marketing. That's not us, but that's what we're here to do today, right? Toot your horn. We're all that's what this is.
Yeah, I know. So it's great.
Cool. So let's see. Looking at so we sent out questions, right? I'm just trying to figure out like what we haven't covered. I think we've really
I read through all the questions you sent me. I hopefully answered them.
Oh, they're great. No, they're amazing. I think you touched base on everything. I mean, any other Anything else that you want to add? Anything else, like whether it be for people who are cautious about cash-based PT as a consumer, or about PTs who are thinking about going cash-based? Any other like nuggets that you want to provide for them?
Yeah, let me think. I would say for the consumer, when you see somebody who's cash based, they truly are passionate about what they're doing and they really care about you, especially during this pandemic. I have several women in their later stages of pregnancy, and I've had a few of them tell me that I'm literally their lifeline. So I would say, you have so much more access to the person than you would if they were in a hospital because of all the barriers. And then for the practitioner, because of that, you really have to protect yourself. So I had to discharge a male client who was being inappropriate. And I think he was specifically seeking out somebody that didn't have those layers of protection like you would in a hospital. And so that was a really good experience for me to have early on, because I feel like I'm so grateful that I was able to, number one, respond appropriately and trust my gut and be the utmost professional that I am, but also protect myself. So going into it, I do think that you do have to be aware, and know that it's not like you can just go to your boss and say, hey, this doesn't feel right. You have to take charge and advocate for yourself. And at the end of the day, you need to be safe and your patient needs to be safe. So that would be for somebody thinking about going into pelvic health, especially if you're seeing, all genders, it can be challenging. So so my sister is a social worker, and she had some amazing language to help me kind of de-escalate the situation and also get this person the resources that they needed with some mental health issues. And so I'm so grateful that I had that resource, but not everybody does. So just knowing that if you are going to be seeing a variety of clientele, then you also have to make sure that your environment is safe and that you're safe too. So I guess that would be a nugget to share.
Yeah, that's great. I think that brings up such a great point about resources and really, seeking out other healthcare professionals in your community to have those resources for patients, because especially in the pelvic health world, we come across so many things, all the things. And to have trusted resources in your community, because people build that relationship with us as pelvic health therapists, to be able to say, hey, I know this is something you would benefit from. Here is a list of resources of people I trust. I mean, how great for the clients to have that. And, when you are a cash-based private practice therapist, you tend to build those relationships. It's harder sometimes in those bigger systems. So that brings up such an excellent point about other resources.
Yeah.
I love that.
Yeah. And I think for sure with us, it's mental health counselors, sex therapists. Sometimes somebody, needs pelvic floor PT, but perhaps they need those other resources in conjunction, or maybe even first,
Right.
so they can actually get the benefits of our services.
Absolutely.
Build your network, right? Build the network. That's another statement, right? Another nugget for people who are in the community.
Yep, absolutely.
Cool. Well, this has been lovely. I'm so glad we everyone who's watching. This is Dr. Alexandra DiGrado. She's amazing. We're going to link all of her information in the comments below, so you'll have her Instagram handle and her website, and anything else that she really wants to share about herself or about her practice. Let us know what you think. Comment below, share with your friends, and there will be more of these to come.
Cool.
So
thanks so much,
Alexandra.
Thank you.
All right.